Hi everyone, welcome back to the Pilates Mom. Today I'm going to be bringing you my first postnatal Pilates workout. All right, this is going to be geared more towards those who are 6, 7, or 8 weeks postpartum. It is vital that you make sure that you are cleared by your doctor to start an exercise program, and this is really just for your own safety. All right, but once you are cleared, this is the perfect video to start just to learn how to reconnect, learn how to pull your belly in and start strengthening and fine-tuning those muscles again. Um, if you have any questions, I am here for you, so please comment, and I will be sure to reach out. But like and subscribe below, and I hope you enjoy this program. Okay, so let's get going. So today we're just going to need a mat or a soft surface, and I'm going to be using a Pilates ball as well, which can help just stabilize and get you a little bit connected deeper into our deep abdominal muscles. Okay, so once you have all your accessories, let's come on. We're going to start onto our hands and knees. We're going to just start with some cat and cow just to kind of get our body moving again. All right, so find your shoulders and wrists in alignment, and your knees and your hips in alignment as well. So let's start by scooping our belly and rounding our back. So we call this flexion of our spine. And then exhale and feel extension of our spine. So we're like arching our back, looking up. Good. Inhale, scoop and articulate your spine. Feel your belly start to turn on here. And exhale. And let's take one more. So moving through these two extremes of our spine, which will help us now find where our center is. So center, or what we also call as neutral spine. So we want a straight line, right? A little bit of, our natural curvature of our low back. Okay, so we want to maintain that. But now what we want to do is think about drawing our navel up and in toward your spine without rounding. Okay, so we're staying long. Okay, and sometimes it's easier to feel this in this position because you're moving your belly against gravity. So sometimes people feel a little bit easier way to connect. So pull the belly up and in towards your spine and then let it release. So just learning how to re-engage, okay, and release. Pull in and hold for 3 and 2 and 1 and release. And let's do one more. Pull belly in, 3, good job, 2 and 1, very good. And now let's pull that belly in and let's slide one foot out and slide it in and release. Now since you are early, so engage and slide and in. So since you're early in this rehab, you might not have enough endurance in the muscles to sustain that contraction. So you might need to kind of reset after each one, which is fine. Okay, so reset, pull the navel in, extend one leg out, and return. Let's take one more each side. So belly draws in, keeping our neutral spine, extend one leg, draw it in, and release. And last one, belly towards your spine. Set that foundation, extend that leg, draw the knee back in, and let's all sit back into a child's pose. Just keep breathing. Very nice. Let's come on up, and we're going to go right onto our back. And this is where I want you to grab your ball. And I'm going to have you place that ball right between your knees. And this is going to help us connect deeper into our pelvic floor muscles by activating our inner thighs or adductors. It's going to help us connect a little better to the deep belly muscles and pelvic floor. Okay, so we're going to sit nice and tall to begin. We're gently squeezing the ball, so not too aggressive, just enough to turn on those muscles. We're going to now scoop our belly and start articulating back. I want you to look at your belly. Good. Feel that belly scooping and then articulate that spine back up. Okay, so what we don't want is doming of our belly, right? So if you're seeing that, I want you to just really think about the belly scooping down and underneath your ribs. Good. And then exhale to return up. Okay, so inhale, going back. Good. And exhale to return. Good. And let's take 2 more. So inhale, scoop the belly. Feel and squeezing that ball, feeling that connection to our inner thighs, our pelvic floor, and our low abdominal muscles. Okay, this last one, we're going to roll all the way down. So inhale as we start articulating, rolling down. Use the connection with your hands to your thigh to help support you down to your back. Very nicely done. So now we're on our back. We're maintaining our neutral spine, right? So we should have a little bit of space. We don't want to think about flattening. We want to think about keeping that tailbone long, the ribs down. We're just going to take some breathing. So we're inhaling, feeling your ribs expand, right? Front, sides, and back. And then exhale, I want you to squeeze the ball and feel your navel drawing down and in. Okay, inhale, release the tension of the ball, feel the ribs expand. And exhale, gently squeeze the ball. Feel that pelvic floor muscles turning on. Feel the low belly scooping down and in. And inhale, release. We have 2 more. And exhale, squeeze that ball. Feel the low belly drop, maintaining your neutral spine. Inhale, release, and final one. And exhale. Nicely done. Let's take that ball and place it right off to the side. Bring your feet and your knees together. We're maintaining our neutral spine with our belly scooping down and in. We're going to open one knee at a time, opening it out to the side, and then use that inner thigh and close it back to the starting position and switch to the other side. So we're inhaling, letting one knee fall out with control, and then exhale, scoop the belly and return that knee to the start. Okay, inhale, open the opposite knee to the side, and exhale, return. Now, what I want you to think about and be mindful of is not letting your pelvis shift around. Okay, so we're using our belly muscles to maintain stability of our pelvis. So the only thing moving is our hip. Okay, our hip is externally rotating, which is allowing our knee to open out. And exhale, return. Right, so it just takes that extra thought. Let's reconnect, rewire our brain, all right, to turn these muscles on again. Okay, let's do one more inhale. And exhale, nicely done. Last one. Good, and final set, here we go. And close, nicely done. Okay, so let's widen the feet out again. And actually, let's grab our ball and let's place it back between our knees. We're going to flow through some bridges. Okay, so here we're going to, just like we did when we were sitting, we're articulating our pelvis and rolling. So let's just start with a little bit of pelvic tilts. Okay, so we're going to inhale. Let's flatten our back and tilt your pubic bone up to the ceiling. And then exhale, feel that tailbone pushing down and away towards your feet. Okay, so inhale. Scoop and tilt that pelvis up just about where you're about to lift off the bottom. Good. And then one more. Inhale, scoop the belly, rotate that pelvis. Pubic bone is up towards the ceiling. And then exhale, pubic bone is reaching down, tailbone is reaching down. Okay, now let's flow through the bridge. Okay, so inhale, scoop, right, flatten your back and start peeling your bottom up. Only go to the height that you can control. Give a little bit of squeeze with that ball just to help get you connected into your pelvic floor. And then pull the ribs down as you start to articulate. Scoop that bottom 1 inch more and start articulating all the way down to the starting position, which is that neutral spine, tailbone down. Inhale, scoop, flatten your back and start peeling your spine up and off the mat. And exhale, ribs pull down first. Get the diaphragm involved, so really use that breath to help. Okay, good. And inhale, scoop and articulate. As you lift your bottom up and off the mat. Good. And exhale as you articulate down. Let's take one more. Okay. Inhale, scoop and pull that belly in, squeezing that ball gently. Good. And exhale, ribs pull down. And finish in that neutral spine. Nicely done. Let's stitch the ball, place it off to the side. We're going to move into what we call a clamshell. So we're going to roll to our side, and I want our knees in front of us and our feet stacked on top of one another. So we ideally want our ankles, our hip, our shoulder, and our head directly in one line, and the knees are slightly in front. So we're going to continue to work on some of our glutes just to get them stronger. You know, as we're carrying our child, those muscles get really stretched out, right? Our pelvis kind of shifts and widens in preparation for birth. All right, so it's really important to fine tune, get those muscles strong again, since they have, you know, made some adjustments for our newborn baby. All right, so what we're going to do is keep our feet together and lift the top knee up. Okay, and lower. So we want to maintain our hips stacked on top of each other. It's very common to start rolling back. So don't let that happen. All right, and sometimes it's helpful if you have your hand here and you lift only the height that you can and lower. I do want you to feel your glute muscle though. All right, so as your knee is lifting, I want you to feel that butt muscle kind of turning on, which will help you engage and strengthen those muscles. Okay, we're going to inhale to lift and exhale. Now, I forgot to mention too, we're always thinking about pulling and drawing our navel up and in, stabilizing our spine, stabilizing our pelvis. Okay, so there's a lot to think about. Okay, you're doing great. Let's take 3 more. Inhale to lift and exhale to close. Nice. Inhale and exhale. Good. Final one. Inhale. Nice. And exhale. Nicely done. Let's roll to our stomach. We're going to do a little bit of extension. The first few weeks of postpartum, right, we're carrying the baby. Everything is very rounded forward. Shoulders are forward. We're feeding our child, right? So it's going to be really important to start opening up our back, and it should feel really nice. So I want us all to start with our head down. We're going to inhale, float our eyes up, and then find extension. Push into the hand and lift your spine all the way up wherever is comfortable. And then exhale, you're articulating your belly first, your ribs, your chest, and your eyes and head go last. Great job. Inhale, eyes and head float up. And start articulating up. And exhale. And do articulate down. Let's take 2 more. Nice job. Inhale, eyes and head up. Feel the extension. Feel your back opening. Pull those shoulders down away from the ears. And exhale as you articulate down. Beautiful job. Last time. Inhale, eyes and head. And reach. Good. And exhale. 1 vertebrae at a time. All the way down. Let's continue pushing into those hands. Prop up and find a child's pose stretch. You can widen your knees apart and just sink down and feel your back opening, the shoulders opening, and just take a moment here. Breathing in through the nose and out through the mouth. Very good. So let's roll on up, and we have side 2. So I'm just going to flip this way here. Okay, so we're going to do side 2 for our clamshells. So again, Shoulders, head, neck, and ankles are in one line, and the knees are slightly forward. Hips are stacked on top of one another. You can use your hand here for a little bit of kind of cueing, and then also think about pulling our navel up and in, supporting our pelvis. Okay, we're going to keep our feet together, lift the top knee up, and then exhale to return with control down. Good job. Inhale, lift, and exhale to lower. Good. Inhale and exhale. Make sure that belly is pulling in. Good. And exhale. You might need to reset each time, like I said before, and that is okay. Okay, the more that you start to bring more awareness to those muscles supporting your body, the better. Okay, so inhale, lift, and exhale, lower. Good. Lift and lower. 2 more. Lift and exhale down. Last one. Lift. Good. And lower down. Let's roll to your back and let's finish with a stretch. So let's bring one knee into the chest and just extend one leg to your own working level. I just want you to feel a nice good pull in the back body. You're welcome to hold higher up or at the knee. And if your knee is not straight, that is okay. You work within the length of the muscle that you have. Okay, let's bend. Good, and let's flex it as you reach up. Good, and bend. Good, and flex it up. And the last one, bend and extend. Good, and let's switch. So bring the opposite knee in. And then extend it to the own length of your own muscle. Okay. And just breathe. Make sure you're trying to relax into these stretches. Okay. Now let's bend that knee and flex it up. Good. And bend. And flex. Good. Last time. And flex up. One more gentle pull. Good. And plant that leg down. Let's grab a hold of our thighs. We're going to inhale here. Exhale, let's lift the head, neck, and shoulders up and start using the strength of our arms to pull ourselves up to a seated position. Very good. Let's finish one more additional stretch. Okay, so find a comfortable position sitting, maybe with your legs crossed. You can also fold your mat or lift or sit up onto some yoga blocks just to lift you up a little bit if needed. Okay, I want us to lift our arm up and over. Good. Now return that arm back to the side, but leave your neck side bending. So you should feel your upper trap muscle here stretching out. Good. And return. Let's do that one more time. Reach up and over. Breathing. Feel your side body stretching. Good. And now return that arm, but keep your ear reaching towards your shoulder for a nice, good stretch. Good. And return. So when we're feeding our child and rocking, right, everything is down, and these muscles can get very tight and cause some strain to our neck. So it's good to keep everything really kind of loosened up. All right. So let's do the other side. Inhale, reach up and over. Good. Again, your own working level. Everybody is different. Reach that arm down, but keep that neck reaching away, ear to opposite shoulder. Feel the length in this side here. Good. And return. Last one. Inhale, reach up and over. Good. And reach that arm away. Pull that arm down. Allow that arm to kind of weight that arm down to deepen into that stretch. You can also grab gently, just to intensify that stretch if you need to. Okay, good. We'll take one final stretch. You're going to rotate your head to the left and look down almost into your armpit. And you should feel a good pull from the top of your head down to the tip of the shoulder blade. Okay. And return back up and to center. And look to the right and then down and into that armpit. Good. And return, last set. Look to the left and then rotate down. So you might need to play with the angle a little bit. We want the pull to be in the back from the neck to the shoulder blade. Good. And return, and other side, looking to the right and rotate down and into the armpit. Good. And return to center. Let's final thing. We're going to reach forward and then open, squeeze, and kind of open. Feel like you have a string pulling the chest. Open up the chest and then close. And you can even round a little bit here. And then reach open and find extension. And exhale to close. Good. 2 more. Inhale. Good. Open the back body. Good. And exhale. And last one. Feel the nice good stretch in the pecs. Good. And exhale to close. And come up to a tall seated position. Great job, everybody. Keep working and showing up for yourself.